Good afternoon, Bennett Leo. Let's begin the warm-up session. What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills which help them not only to gather clinical data but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Your preparation time is over. Please start your OET-speaking role-play.
Good morning, Mihiraa. I am your attending nurse Bennett here. Today, I'm here to check on your progress and ensure you're healing well. I'll be monitoring your vital signs, checking on your wound dressing, and inspecting the drain tube site. How are you feeling today?
Good morning, Nurse Bennett. I'm getting better, I think, but I still feel a bit of pain, especially when I move around. It feels better only after I get my medication.
Mihiraa, I understand that the pain you're feeling can be discouraging, especially when it flares up as you try to move. But please know that some level of pain after surgery like this is very common, and it's part of the recovery process. Your body has been through a lot, and it's still healing. I want to reassure you that we're closely monitoring your pain and will keep your doctor informed about how you're feeling. They might consider adjusting your pain management plan if needed, including reviewing the antibiotics or pain relief options to help make you as comfortable as possible. In the meantime, I encourage you to keep noting when the pain comes up, whether it's during certain movements or at specific times. Sharing these details with the doctor, including the location and intensity, will help them tailor your treatment more effectively to your needs. We'll continue to work together to keep you comfortable as you recover.
Definitely. And what about these tubes? They're uncomfortable, and I feel like they're always getting in the way when I try to move.
Mihiraa, I know having this tube in place can feel uncomfortable and restrictive, especially when you're trying to move around. Let me explain a bit about why it's there and how it's helping your body heal. This drain is actually doing an important job. It's removing any extra fluid that may build up around the surgical area. By clearing out that fluid, the tube helps prevent infection and keeps the area clean, allowing your body to heal more effectively. Moreover, it's very common to have a drain like this after a surgery like yours, and it's only a temporary part of your recovery process. As you continue to heal, we'll monitor your progress, and when it's safe to do so, the tube will be removed. I understand it's not the most comfortable part of your recovery, but Mihiraa, it's there to support you and promote the best possible healing outcome. If there's anything we can do to help make you feel more comfortable with it, please let us know.
Okay, it makes sense. But why do they need to remove and change the wound dressing so often? It feels uncomfortable every time they do it.
I understand, Mihiraa, it can be uncomfortable to have the dressing changed frequently. The reason we do this is to keep the area as clean as possible and to check for any signs of infection, like swelling or redness. By changing the dressing regularly, we can keep your wound protected and reduce the risk of complications. This is a very important part of the healing process. Please let me know if it's particularly painful or if you'd like me to talk to the team to find ways to make it easier for you.
All right, I get it. Is there anything specific I should be watching out for?
Mihiraa, I know you're managing a lot as you recover, and you're doing a wonderful job so far. There are just a few signs to watch for that can help us make sure everything is on track. If you notice any increase in the amount of fluid coming from the drain, an unusual or strong odor, or any redness, warmth, or swelling around the wound site, please let us know right away. These could be early signs that your body needs a little extra support, and the sooner we know about them, the sooner we can address any issues. You're never bothering us by reaching out. We're here to make sure you're safe and comfortable, so don't hesitate to call if anything feels off or if you have any questions. Speaking of which, do you have any other questions or concerns at the moment?
That's very supportive, thank you. I don't have any other questions at the moment.
That's great to hear, Mihiraa. Thank you for sharing how you're feeling, and let's go ahead and check your vital signs now to see how you're progressing. Is it okay if I begin with that?
Yes, you may please.
Thank you. Now, Mihiraa, let me go over what we've discussed to make sure everything's clear. First, regarding the pain you're feeling, I want to reassure you that it's quite normal to experience some discomfort after surgery. We're monitoring your pain closely, and your doctor is informed. Tracking when and where the pain occurs, especially during certain movements, will help the doctor adjust your pain management plan as needed. About the drain tube, I know it can feel uncomfortable, but it's in place to prevent fluid buildup around the surgical area, which helps reduce infection risk and promotes healing. The tube is a standard part of post-surgery care and will be removed once it's no longer needed. As for the frequent dressing changes, I understand they can be uncomfortable, but they're essential to keep your wound clean and help prevent complications. Regularly changing the dressing allows us to monitor for any signs of infection and support healing. Finally, if you notice any unusual signs, like increased drainage, a strong odor, or redness around the wound, let us know immediately, as these could indicate an infection. You're doing a great job with your recovery so far. Please reach out if you have any questions or need additional support.